a common oral health issue known as gingivitis. Gingivitis is a mild form of gum disease that, if left untreated, can progress to more serious dental problems. To help us understand and manage gingivitis, we are joined by dentist Dr. Anna Shikwaya. Dr. Shikwaya, good evening.
Good evening, Nina.
Thank you so much for being here.
Thank you for having me.
Let's talk about what the main causes of gingivitis are.
Gingivitis is mainly caused by buildup of dental plaque, and this is a result of poor oral hygiene. Yeah, basically, that's what causes gingivitis.
And how does your poor oral hygiene and the buildup of plaque contribute to gingivitis? How does it cause gingivitis?
Yeah, so when the teeth are left without being cleaned on a daily basis, so the food, the saliva, the bacteria that harbors in our mouth, like on a normal way, they build up and they cause dental plaque. And this accumulation of dental plaque then hardens, and when it's hardened, it then causes calculus and also tartar. And these tartars, when they build up, they irritate the gums, and when they irritate the gums, then they triggers the immune response, and this immune response is the one that causes now or lead to the inflammation of gingiva, which we call gingivitis.
Yeah. And the symptoms of gingivitis is, as we would commonly know it, just bleeding gums. But I'm sure it's more severe than that, because how do I know I'm not just brushing my teeth very hard and that's why it's bleeding, as opposed to now I've got gingivitis, it's actually a problem? Yeah.
Symptoms, it's redness. It's when you like open your mouth and look at your gum, they will be like a little bit red, because the normal gum is pink, not red, and they are very prone to bleeding. Whatever you do, whether you take a toothpick, a little bit of a minimal touch can cause bleeding. They are also, the gums are swollen, they look barky and bulgy. Then you like, and also they are, sometimes it's very painful, and sometimes also they will release some pus. Then you will know, like, yes, my gums are swollen and they are tender, like they are painful.
Are there any predisposing conditions that would increase your likelihood of developing gingivitis?
Yes, there are. Like poor oral hygiene is one of them, the main cause. And we have some things like hormonal changes, like during menopause, puberty, or menstrual cycles. This causes the gum to be a little bit sensitive, so it's prone to it to bleed. And also to inflame, to inflammate, and also we have things like other diseases such as cancer, HIV. This one that mostly go on and reduce our immunity, and also some drugs, certain drugs like Dilatin, for people who are either suffering from epilepsy, and we have calcium channel blockers for people that are suffering from heart diseases, and some other factors or social factors such as smoking, abuse of alcohol, chewing of tobacco, age also. As people grow old, they are also prone to develop gingivitis, and also some other factors which include maybe genetics, family history, like maybe it's run in the history of family to have this kind of what. And also vitamin deficiency, like vitamin C is one of the cause, can lead to like gingivitis, like scurvy, like it's one of the diseases which can cause gingivitis higher.
What are the potential complications that can arise from leaving gingivitis untreated?
Okay, this one is we term it periodontitis. It's like the worst case of gingivitis when it's left untreated for a long time, then it develops in periodontitis. And periodontitis, it's when the supporting thing that support the teeth, supporting structure of the teeth have like been eaten up by bacteria. Now the teeth become loose, and when they become loose, the end result will be like the teeth falling out of your mouth. So we are trying to avoid that. And other complications can be like this, HABA, like chronic gingival inflammation. Can be like the bacteria that are harboring around that area can be transported to other part of the body, where it can cause some life-threatening diseases such as endocarditis, it can cause pneumonia, it can cause meningitis, so it can be carried through the bloodstream, like the infection. And there's another one which we call NAG. It's necrotizing ulcerative gingivitis. This is very painful, so the patients are going to have ulcers in the mouth, and it's very going to be painful for them to eat, drink, so it will also affect their quality of life.
Yeah. Let's talk treatment, doctor. How do you treat this disease?
Yeah, treatment, if you catch it on time, like it's just at a plague kind of stage, so you can just brushing, cleaning that plague away, and also just use warm water with salt just to like level the bacteria. And also you can go to the pharmacy, over-the-counter medication, like maybe paracetamol just for pain, and also antibacterial mouthwash just to like wash away these bacteria in the mouth. But if it goes to tartar and calculus, the yellow things that are stuck on your teeth, only dental professionals or dentists can help you, because then we have to use our professional tools, which is scaling, to clean away these tartars and calculus.
As I mentioned in the beginning, it's Oral Health Week, so your tips to the public on maintaining a good oral health?
Yeah, good oral health, you have to maintain it by brushing twice a day, like I mentioned the other time I was here. Then about brushing, you have to brush twice a day. In the morning after breakfast, not before. After breakfast, and evening before you go to bed. Floss once daily. Try to eat healthy food, which is rich in vitamins, so that you will not have deficiency. And also try to brush your tongue. And I also advise that when you eat, try to take water in between your meals, so that you wash away this loose food, so that they shouldn't be stuck in your mouth for the longest, and they mix up with salivas and bacteria, and in the end you will have this dental plague, tartar, then gingivitis. Yeah, so that's it.
Dr. Shikwaya, thank you so much for being here. Always lovely speaking to you.
Okay, thank you for having me, Nina.
That was a dentist, Dr. Anna Shikwaya, speaking to us about gingivitis in honor of Oral Health Week, which is this week. When we come back, more conversation